Finding your way with ocular melanoma, join me, host Tara McCannell, as I share with you everything I know about ocular melanoma. I hope you will learn, get your questions answered, and be motivated to empower your healing. Please visit my resource page, sayhart.com/ocular melanoma. That's SEYHART.com/ocular melanoma for more content and support. There you will find my handbook for patients and families, previous recordings of episodes of this podcast, recordings of past live webinars, as well as additional resources, group counseling, and support. Just of note, please attend my next live webinar, all about prognostic biopsy, coming up on Sunday, June 29th. Visit the resource page for details and registration. Today, I'd like to talk about a topic that is very important in all of cancer, the staging of ocular melanoma. What do we mean by staging? The American Joint Committee on Cancer has devised a universal type of staging description for all cancers. The American Joint Committee on Cancer, I will call this AJCC, has over the years evolved its classification of ocular melanoma. First of all, why do we need to have our cancers staged? You may have found that when you visited your ocular oncologist, there was no mention of staging. Even in my own practice, I don't usually assign a stage to the cancer at the time of diagnosis. Let me give you some background. The reason why staging is not necessarily a routine part about the specific rare cancer, ocular melanoma, is because over the years, the staging of the ocular melanoma doesn't necessarily guide us in the best treatment option, nor does it necessarily accurately predict the development of metastasis. So let's think back about what are the risk factors for metastasis in ocular melanoma. By far and away, the most important risk factor is tumor size at diagnosis. Beyond that, there are other nuanced risk factors that we'll talk about briefly. The smaller the ocular melanoma is at the time of diagnosis, the lower the risk that it will spread in the body. When ocular melanoma spreads, it tends to go to the liver for reasons we are not entirely clear on. However, even an ocular melanoma that is found to be on the larger side may not necessarily spread to the liver. We might not necessarily get metastasis. We have found that over the years that there are other factors that may contribute to one's risk of metastasis. In addition to the size of the melanoma at the time of diagnosis, one of the factors is molecular information. What is the tumor biology? So in addition to the size of the melanoma, many times a sample of the tumor will be taken at the time of treatment to give additional information. This sample can tell us if the ocular melanoma is a low risk for possibly spreading or metastasizing, or if the melanoma is a high risk of spreading or metastasizing. Please keep in mind that these are only risks. If you happen to have a large melanoma with high-risk prognostic biopsy results, it still doesn't mean that you will metastasize. And I want to say that over the years that I've been practicing ocular oncology, I have many patients with big tumors, high-risk markers, and people are alive and well over a decade later. And I'm sure that others have experienced this as well. On the flip side, even if you have a small melanoma with low-risk prognostic biopsy results, it is still important to be monitored, to follow yourself for metastatic disease. The biopsy results, our prognostic guidance is not 100% accurate. So even people who have small melanomas with low risk markers, you can still develop metastasis. So in the big picture, we are not 100% accurate at identifying and predicting your futures. All we have are probabilities, and probabilities always have room to go the other way. So keep that in mind. It's important to be monitored by your oncologist at a regular interval, regardless of what these results show. And there has been plenty of data that tells us that we are not that accurate at predicting when metastasis is going to occur, if metastasis is going to occur. But we do have markers and features that give us some guidance. And that brings me back to this AJCC tumor node metastasis classification system of staging ocular melanoma. And I mentioned before that you might not have been automatically given a stage of what your cancer is at diagnosis. And when I think about it, we don't, because the staging in ocular melanoma usually doesn't inform us or guide your doctor in figuring out the best way to treat this melanoma, this may not come up. But it often comes up when you visit your medical oncologist, who is much more used to dealing with all types of cancers for the most part, and will automatically give you a stage. So when I've reflected on this topic and been in communication with the medical oncologist with whom I work, it makes sense that we would want some kind of stage. We need to have some kind of reference point. And particularly if you have just been thrown into this world of ocular melanoma, it makes complete sense that you want some definitions. You want to know where you stand. You want to know how to think about this cancer. If you have been diagnosed with another type of cancer, for example, breast cancer, there is so much more knowledge and familiarity because many of us know people who have had breast cancer and been treated for breast cancer, and we understand that if it's limited to the breast, this is good. If there's nodal involvement with the lymph nodes, not so good, and it makes more sense. But when you first hear about ocular melanoma, it's in the eye. It's hard for people to understand what's going on because not only have people almost never have heard of eye cancer, what is going on in the eye? How do you stage the eye? So it makes sense that there can be a lot of confusion about this diagnosis, and knowing what your stage is on kind of a scale of 1 to 4, this can help identify that. So let's talk about what this means. So in ocular melanoma, the AJCC staging classification doesn't necessarily tell us what the best way to treat your ocular melanoma is. So if you know your stage, think of the stage of the cancer as separate from your treatment. So you have it treated based on criteria that your ocular oncologist uses, whether you can save the eye or have the enucleation. The stage of your cancer doesn't matter. Leave it to the ocular oncologist. Every single person who treats ocular melanoma has their own unique threshold where they may decide to remove the eye or not. And just make sure that all of that is clear to you and that you ask the necessary questions to make sure that you understand why you're being treated the way you are. Now, let's go back to the staging system. What can the AJCC tumor node metastasis staging system help us with in ocular melanoma? Well, as I said before, it's just very helpful to know where you are on this continuum. And the stages of cancer typically go from stage 1 through to stage 4. Stage 1 being the least involvement, stage 4 being a more advanced a more advanced description of the condition. So, for example, if you know that you're closer to stage 1, you can understand that you have less involved, the cancer is more minimal, it's less serious than if you are stage 4. So, let's understand this in a more clear way. So, We do find that the data shows that people who have ocular melanoma that are closer to the stage 1 group tend to do better. They have fewer incidences of metastasis, and people's eventual outcomes are more favorable than if you are at a stage 4. But as I said before, please remember, it's not completely accurate. Many stage 4 people with ocular melanoma are doing very well. So let's dive in to the subtypes of the staging. I mentioned before tumor node metastasis. This is a key part of how we rank ourselves on the staging system. T for tumor in ocular melanoma refers to the size, both the thickness, how tall it is, and the diameter. The diameter, we call that basal diameter, or the term greatest basal diameter. You'll see it abbreviated as GBD, the greatest basal diameter. This diameter essentially refers to the footprint of the ocular melanoma, the space it takes up as it sits on inside the eye, and then the thickness is the second dimension. So the T stands for the tumor size, and it also has to do with the location. And in this particular staging system, what matters in the location is whether the melanoma is in the ciliary body, which is the very far edge of the retina, or if it is not in the ciliary body. And I will talk about those details in a moment. What is N? Nodes. In many other types of cancer in the body, if there are nearby lymph nodes where drainage from the cancer may come from, sometimes cancer cells can be found in nearby lymph nodes. For example, I mentioned before breast cancer. The lymph nodes that may be involved in breast cancer are the axillary lymph nodes, which is basically in the armpit. There are nodes there that may be found to have cancer in them. So those nodes are often biopsied in the setting of breast cancer if necessary. However, in ocular melanoma, there are no nodes involved. Nodes are simply not a part of ocular melanoma. We don't check lymph nodes. There are no nodes specifically that drain from the eye. So you will see in this staging system that N is always 0. But because we're doing the AJCC classical staging system, we have to talk about TN for nodes and M. So N is always going to be 0 because there are no lymph nodes from which things drain from the eye. What about M? M stands for metastasis. In ocular melanoma, metastasis almost always involves the liver. However, when you are first diagnosed with ocular melanoma, it is very rare that people have any metastasis when they discover that they have an ocular melanoma. The cases where metastasis may be found at the time of diagnosis is only when the ocular melanoma is very large, usually so large that the eye needs to be enucleated, or so large that the vision is extremely poor. And that usually means it's been there for a long time and has a higher chance of metastasizing. So M stands for metastasis. And for most people with ocular melanoma, M is also going to be 0 at the time of diagnosis. So TNM staging, N 0, M usually 0. Now we have to focus back on T because T is really the main variable that will categorize you in stage 1 through 4. So T really is how big is this thing and where is it located? How do we determine how big the ocular melanoma is? This is determined by ultrasonography. When you are diagnosed, when you are monitored, when you are seen in follow-up, ultrasonography is a key part of the evaluation because the ultrasound allows us to come up with very specific numbers and measurements that can be compared from visit to visit, from baseline to post-treatment. And so the ultrasound is a key part in determining what your T is. Using things like MRI or CT scans, not as good as ultrasound. Those scans you need to have a much larger mass in order for those tests to be used. In other parts of cancer, when we're looking at cavities in the body and structures that are much bigger, the MRI and the CT scan may be used to measure the size. But in ocular melanoma, when we're talking about that eyeball, which is much smaller, ocular ultrasonography is key. Let me point out that on a separate note, if you get a biopsy and you get prognostic information by monosomy 3, disomy 3, class 1, class 2, PRAME positive, PRAME negative, and now there's many other things that they can look at. This result has nothing to do with your AJCC tumor node metastasis staging system. That is completely separate. That is a prognostic thing based on biology. So we're going to not talk about markers, biopsy. That's not part of this conversation. So let's dive in to the different categories in T, because T is really what it's all about. I'm going to share a table which has been published in a journal called Retina Today several years ago that will help illustrate this. All right. Please look at this table to help you understand where your size, the T category, may fall. If you look at the graph in general, you can see that there are a lot of 1s, 2s, 3s, and 4s. The 1 is in white, the 4 is darker. So as you go from 1 to 4, you move to a higher stage or a higher T category, because T can be broken into 1, 2, 3, 4. Where are you? So if you look at the column to your left, these numbers refer to the thickness. That is the height of the ocular melanoma. How tall is your ocular melanoma? You can see that on the greatest category, that is the first line, greater than 15 millimeters in thickness tall. If you look to the right, everything is T4. If you look to the bottom, which is less than 3.0 millimeters, if your melanoma is less than 3 millimeters thick, you are mostly 1, unless the basal diameter is broad. So by broad, you would move in to the T2 category if the basal diameter is 12 millimeters or more. When you have your ultrasonography, the ultrasonographer measures the basal diameter as well as the thickness. Both of those numbers help play a role in coming up with your T category. So you can see as you move from a small thickness to a bigger thickness, the T category may increase from 1 to 4. And if you can see that you can have a very relatively thin melanoma, but if it's broad, meaning the basal diameter is broad, that can still push you into a 3 and 4 category, even with a small thickness. And vice versa. If you have a melanoma that is very elevated, you need to take that in consideration with the basal diameter. So now I want to talk about, I want to share with you the different breakdown. Now we know if you're T1, 2, or 3, 4. Each of these breakdowns of 1, 2, and 3, 4 can be further subdivided into A, B, C, or D. So you say that you have a T1 melanoma. It's 3 millimeters in thickness and it's 10 millimeters in basal diameter. You would be a T1. Now, what would you be with A, B, C, and D? So A means that you do not have the ciliary body involved. That means your melanoma is somewhere else in the fundus, in the retina, but does not involve the very far edge, the ciliary body. If you are B, that means you are involving the ciliary body. So the ciliary body, that very edge part of the far peripheral retina, is involved. What about C? C is if you do not have the ciliary body involved, but the cancer has been found to be growing outside of the eye. D would be if the ciliary body is involved and you have the cancer growing outside of the eye. As you can see, our research has showed us that if you have the ciliary body involved, usually there is more risk for metastasis. It's a little more serious, and tumors of the ciliary body are often detected later, so they may be bigger. If the cancer is no longer limited to the eyeball but growing outside of the eyeball, that's a little more serious. We call that extrascleral extension. And how do we know if it's growing outside of the eyeball when you're diagnosed? We know that by ocular ultrasound. The ultrasound can tell us, it can look through the back wall of the eye and the adjacent tissues and show us if there's tumor growing outside of the eyeball. So A, B, C, D. A is the best, D is the most serious. I'll just review this again. A means there's no ciliary body involvement. The cancer is not growing outside of the eye. B means the ciliary body is involved in the location of the tumor, but there is no cancer growing outside of the eye. C means the ciliary body is not involved, but the cancer is growing outside of the eye. D is you have both the ciliary body involved and the cancer is growing outside of the eye. So you're either T1, 2, 3, 4, and whatever you are, say T1, there is an associated A, B, C, D with that. So I'm going to share with you a graph that tells us what stage that refers to. All right, so let's look at this graph. Again, this is also from the article in Retina Today, which was published in 2018. And look at the first column. This is all the different combinations and permutations of the T. Now, the T, say that you are T1A. There are no nodes, there's no metastasis. Your stage is stage 1. And we can keep going down this table. Let's move down a little further. Let's say you are, I'm going to go to the middle of this graph. You are T3B. And B means the ciliary body's involved. And if you happen to be a C, meaning that you don't have the ciliary body involved, but the tumor is growing outside of the eye, and we'll move across, there's no nodes because we don't see nodes in this cancer. Metastasis, there's no metastasis. But if you have ciliary involvement and a big enough tumor and it's growing outside of the eye, you would be considered stage 3A. So I'm going to leave this here for you to look at or take a photograph of, and know that this is the way we calculate your cancer stage in the setting of ocular melanoma. So what matters most is the T, how big it is, how thick it is, and the basal diameter, and where it is in the eye. N, which stands for nodes, is almost always 0 in the setting of ocular melanoma because this is not a cancer where nodes are involved. M refers to metastasis. And metastasis at the time of diagnosis is almost always 0. So if you are curious to know what stage is your ocular melanoma, I encourage you to listen to this again so that you can plug in the numbers so that you know what your stage is, and maybe you don't have to wait till you see your medical oncologist. The numbers that you need to know are all obtained by ultrasound, how thick it is, and the basal diameter. And if you're at the time of diagnosis, it is very rare that you already have metastatic disease. use the graph to figure out what stage you would be. And then you have some framework to think about your ocular melanoma diagnosis, and you are ready to start learning everything possible so that you become an expert and you can help guide this cancer journey for yourself. Thank you.